By April 9th of 2020, 9,282 healthcare professionals have been affected by the coronavirus, and 27 people have died from it at that time. Everyone has been negatively affected by this virus, but we should also try to make the effort and help those who are putting their life at risk to protect us from it. According to New York Times, the report said it is critical to make every effort to ensure the health and safety of this essential national workforce of approximately 18 million healthcare personnel, both at work and in the community. And because of this, we should try to help them so they can be healthy. Today, we'll talk about what healthcare and essential workers are going through, then how the government can help, and finally, what we can do to help them too. First, let's talk about what these workers have been going through and what they are currently going through. Although everyone is scared of this virus, healthcare workers are still putting their life on the line by helping people who do have it. These workers risk their lives to help people when they do have a family of their own at home, and according to Access, a way to help protect their family is by sleeping in another room. A doctor from New York says, "Every morning on the way to work, I wonder if I'll be healthy enough to return tomorrow." And that is not something someone should think of daily just by going to work and worried for their health. In March, 14,500 jobs were cut because federal government said that visits or procedures were not necessary. 96% of healthcare jobs were cut the same month, and these jobs included dentists, clinics, speech therapy, and also vision centers. Because of the coronavirus, everyone in the medical workforce is trying to expand as quickly as possible. Northwell Health told its employees that they would be quickly reassigned to somewhere where they needed help and where they're needed, but without pay, which is hard because they still need to provide for their family and for themselves, and that's really hard when they don't have money to do that. Now that we understand what these workers have gone through, let's talk about what the government could do about it. There are many ways the federal government can help because there are way too many essential workers that are on front line risking their lives. According to Washington Post, the first and most urgent thing they could do is by naming a federal emergency medical supply SAR, which is a supply chain for healthcare and essential workers, like gear when there's a shortage. Another thing the administration could do is order in all food and drug administration restrictions that can help the healthcare workers and hopefully put them at ease too. Because some protective equipment cannot be provided under federal restrictions. So FDA can also be a very good way to help provide these healthcare workers with the gear that they need to continue to be healthy. We now know the ways the government can help. Let's finally talk about what we can do to help them too. There are so many ways we can help. We can help these healthcare and essential workers since we are all stuck at home. Simply by giving essential workers some recognition for their hard work can help even their mental health, and can also even make them feel just a little bit better because they can see how appreciated they are by the entire world. For example, many famous singers have come together on TV and they would sing well-known Disney songs, and at the end of their special or show, a lot of families have submitted videos of them holding signs saying thank you to all healthcare workers and essential workers, and they'll show all these videos at the end, and I am sure that healthcare and essential workers do appreciate that. According to nurse.org, donating to websites as in GoFundMe to help nurses financially, like like St. Louis's Nurse Fund and Washington D.C.'s fund that is located on their website. But these are not the only ways we can donate, but there are so many other ones where we can help other healthcare and other essential workers in many different places of the world. Hackensack Meriden Health says that simply staying at home and following the social distancing rules can help this process go faster, so we can all get back to our normal lives a lot faster. According to Lily, a New York resident named Sophie Vershbow posted on Twitter a picture of her Metro card and stated that she's willing to give this card to an emergency worker that needs to go to work. After she posted this, about 50 people have responded and are willing to do the same. So donating a travel pass or card is a good way to help an essential or healthcare worker that needs to go to work, and can also save them some money too. Another way we can help is by helping them or doing an errand for them, as in like someone you know. This is just to make their life just a little bit easier. An example that Lily states, as in walking their dog, for example. So today we have talked about what these healthcare and essential workers have gone through, how the government could help, and how we could help as well. Let's help them the way they helped us.